Well adjusted today. Woohoo! Okay. Hi everybody, Dr. Kara here. I want to talk about something. You know, as a doctor, I sit down and meet with a lot of patients often, but occasionally I take some time off. I was at dinner the other day with my husband, and not only do I see things going wrong with people's, you know, dislocated shoulder, somebody kind of, you know, stretching and popping their neck while they're at dinner to try and get some relief. Then I see it not work, and them start doing, you know, like all this other stuff, where they're just like uncomfortable and they're stretching, and I literally see, if I see, you know, 90 humans, I'll see 80 of them doing this. Walking with a little bit of rotation, some discoordination in the hip, and so do you guys. Whether you're doctors or the general population, you guys see this. We all move different, and some don't look like they're doing okay or not. And you know what's really funny is people will say, I've never needed a chiropractor before. You know, because all they fix is neck pain and low back pain. And it's brutal to me. It breaks my heart. I'm sitting there, I'm right in front of them. I could tell them what's going on, I could share what would work, it would change the next 30 years of their life, but I know I can't say anything because they either don't like chiropractors, had a bad experience somewhere else, they don't believe in it. I don't believe in chiropractic, I don't believe in that. I got my steroid injections, it was great. I hear this stuff all the time, and first of all, steroids ruin your adrenal glands, they stop the healing process, and I could, if I were to bet $100,000 that your joints degenerated, I would win. And we would prove it via x-ray. If I were to go back in time, take that person's spine, get everything just right, and get them to exercise, eat nutrition, decrease inflammation, get them off the drugs, the degeneration would slow down, and it wouldn't grow. And they would feel better. It wouldn't be instantly in 2 seconds, it would be in a few months, but two totally different stories, right? The next 40 years. Then some people say, who cares, I'm gonna die something anyway, might as well be, I guess that's just how I'll go. And it's just not a priority to them. Until they realize they can't pee, right? You can't get a heart on, you can't digest. Well, I mean, wow, I didn't know that my digestive tract and all that's wrapped up. Well, yeah, if I take, you know, that paperwork you sign during your shots and surgery that say, hey, by the way, there's risk associated here, we could nick a nerve, we could destroy function. We're dealing with the nervous system here. If you talk to a neurologist, they would admit to you, these nerves go places and they do things. And all sorts of drugs either facilitate or inhibit by enzyme inhibitors to tell your body what to do, because drugs are like wireless internet and your nerves are like hardwired internet. So it's doing the job for it. It's not repairing what's going on, okay? As chiropractors, we want to go in and make sure your hardwired internet always works. And I'm sorry, but last time I checked, that's not an asshole move. It's actually pretty nice to come in and make sure that that message is there all the time, okay? And regardless, drugs or no drugs, we pretend that we don't have consequences for taking them. I mean, drugs severely inhibit your liver. So some people don't want to risk seeing a chiropractor that's not good because it's so risky, but the risks are actually far less than taking a bunch of drugs and destroying your liver out. Because if you take drugs for your joints, and take drugs for your depression, and take drugs for your GI, and take drugs for infections, and take drugs for thyroid, and take drugs for inflammation, your liver now has 8 or 9 or 10 or 11 or 12 or 20 jobs. And my question to you is, do you even know what your liver does? So if you don't know what's going on, you're not scared for your liver, but you're scared for something that has a lower probability of happening because you're undereducated. So I hear and see this a lot. People just not being aware of themselves, and if they were, they would probably make different, better, or more efficient choices that actually cost less, that make more sense, that feel better. Okay? And I have never met a human that doesn't want to feel better, doesn't want to save money, and doesn't want to have a better future. So actually, most people would love to meet a chiropractor and love to see what's going on. Now it's just, how do you find a good one? To be honest, I don't care if the whole world emailed me tomorrow. I would do my due diligence to email them all back, okay? Because I'll get you to a good office, at least a better office than average. You know, I speak at the schools. Those of you that are my patients, you know this. I'm gone every other week. I'm speaking, I'm teaching, I'm doing my best to get the next generation out inspired and doing a better job so that we can continuously evolve in our professions, but not just chiropractors. Acupuncturists, naturopaths, you know, there's a lot of physiotherapists and pain management doctors, and all of us are working hard in our own fields to work together and get your body moving, but you gotta show up as the patient. You have to care. Really, there is no say in this. If you don't get educated on your body and how it works, and really it starts with you admitting you own it. You own all your injuries, you own your problems, you own the consequences from them. You know, cancer doesn't even hurt. You don't know what's growing in there, but it's your responsibility to see the doctors to find it, to treat it, maybe to even take care of things before you even develop cancer, because cancer is normal in all of us, and it's promoter cells that actually go in there and start getting it growing out of control, which, you know, a lot of that stuff happens in the liver. So you can't look at a problem, label it, say, aha, that's what it is, and then throw everything at that. You really got to see the dynamics and how it affects everything, prioritize, and come up with a long plan with follow-through, and have a provider that's willing to go with you the whole way. But you, the patient, if you're not willing to put the time and energy into this, we can't. We can't love your spine more than you do. We can't love chiropractic more than you do. I would hope that you would understand that it is a very beneficial tool. Aloha!